Hi everyone, today I'm going to talk about our research on recurrent cell fusion, iterative denoising for consistent retinal OCT segmentation. OCT is a non-invasive imaging technique that can provide retinal layer thickness measurements and can be used to monitor disease course of multiple sclerosis. However, discrepancies in retinal layer thickness measurements arise due to variations in image quality, such as noise level and speckle pattern produced by different OCT devices. This poses challenges in consistent comparison and the interpretation of data across studies. Therefore, we propose the recurrent cell fusion algorithm that aims at reducing speckle contrast, improving SNR, and improving the consistency of retinal OCT segmentation. In recurrent cell fusion, the input is an OCT volume that consists of multiple B scans at different cross-sections on the retina. For each B scan in the OCT volume, we first take out several labeling B scans that are centered at this B scan. For each labeling B scan, we register it to the central B scan by finding the deformation field phi. We apply this deformation field to the corresponding labeling B scan to get a raw B scan that looks like the central B scan. The central B scan remains the same. Next, we calculate local adaptive weights W based on the concept of joint label fusion. The weight parameter W has the same image shape as the shape of B scan, and it is computed locally based on the structural similarity of local patches between the labeling B scans and the central B scan. The basic idea is to assign large weights if the local patch in the labeling B scan is similar as the local patch in the central B scan, and vice versa. After obtaining these weight parameters, we perform a pixel-wise weighted summation to obtain the denoised image. We call the procedure Wang iteration after applying these steps for all B scans in the OCT volume. After one iteration, we repeat this denoising procedure to further denoise the OCT volume. Our dataset consists of 59 MS participants that were scanned on the same date on both specialist and series OCT device. For all 59 participants, both left and right eyes were imaged. So our evaluation is on the 118 eyes, comparing specialist with series. The iterative denoising results of the recurrent cell fusion are shown in this figure. The four columns show examples of original B scans, denoised B scans at iteration step 1, step 5, and step 10, respectively. The first row shows an example of B scan from specialist OCT device. The second row shows an example of B scan from series OCT device. These two B scans are taken from the same participants around similar retinal cross-section. We can see that the original B scans from specialist and series OCT device have different noise levels. The noise level in series B scan is higher than specialist B scan. After performing 10 denoising iterations as shown in the last column, the two denoised B scan contain less noise and look more similar. Quantitative results on all the dataset show that the speckle contrast in each retinal layer decreases as the denoising iteration progresses, as shown in the both plots in this figure. Each subfigure shows the speckle contrast results for each retinal layer, which is 8 in total. Horizontal axis shows the iteration step, while 0 represents the original image. Vertical axis shows the value of speckle contrast, which is calculated as the standard deviation divided by mean. Right both plots show the speckle contrast value for specialists, and the green both plots show the speckle contrast value for series. Since SNR is inverse proportional to the speckle contrast, we can also conclude that SNR in each retinal layer increases. Moreover, we observe that speckle contrast for series B scan initially decreases faster than specialist B scan, and in some layers such as GC-IPL, INL, OPL, ONL, and OS, the speckle contrast values in both specialist and series converges to similar values. After analyzing the denoising performance of the recurrent cell fusion algorithm, we analyze its impact on the downstream segmentation task. To perform segmentation on retinal OCT image, we use a deep learning-based retinal OCT segmentation algorithm. The network was trained on 394 specialists and 321 series OCT volumes. We calculate both unsigned and unsigned difference between segmentation results of consecutive iterations, as shown in both plots in these two figures. The left figure shows the difference results for specialist B scan, and the right figure shows the difference results for series B scan. Each subfigure shows the difference results for each retinal interface, which is 9 in total. The horizontal axis shows the iteration step, while each number means to calculate segmentation difference between the current iteration step and the previous iteration step. The vertical axis shows the difference value in micron. The blue color shows the unsigned difference, and the yellow color shows the signed difference. From these plots, we observe that segmentation results converge for most retinal layers for both OCT devices after applying the recurrent cell fusion algorithm. Since we do not have manual delineation on this dataset, we cannot compare the previous segmentation results with the ground truth. However, since this is a pair dataset where the pair scans are acquired on the same participant, same date but with different OCT device, we can compare the segmentation results from the pair scan in this dataset. To avoid registration between the pair OCT volumes, we compare average thickness of each retinal layer within a circular area centered at the fovea between pair scans instead of directly comparing the segmentation results. The comparisons are shown in this figure. Each subfigure shows the comparison results for one specific retinal layer, which is 9 in total, including the total retinal thickness. Horizontal axis shows the iteration steps for series B scan. Vertical axis shows the iteration step for the specialist B scan. 0 indicates the original B scan. The color of the scatter point shows the mean value of thickness difference in the whole dataset, which is calculated by subtracting the specialist thickness from the series thickness. The blue color shows large negative difference. The red color shows large positive difference, and the green color shows small difference. The size of the scatter point shows the standard deviation of the thickness difference in the whole dataset. From this plot, we observe that recurrent cell fusion impacts more on series B scan than specialist B scan, since series B scan initially has more noise. Moreover, after applying the recurrent cell fusion, the difference of the thickness measurements for all retinal layers from the pair scan converge to smaller values. Apart from comparing the average thickness, we also compare the thickness distribution of each retinal layer between the pair scans. In each scan, each retinal layer, the thickness values within the same circular area centered at the fovea are converted to a thickness distribution. Then we calculate the Jensen-Shannon distance between the pair thickness distributions. The results are shown in the right figure. Each subfigure shows the thickness distributions results for each specific retinal layer. The meaning of the horizontal axis and the vertical axis are the same as the left figure. The color of the scatter point shows the mean value of the Jason-Shannon distance in the whole dataset. The red shows large distance. The green shows the smallest distance. The size of the scatter point shows the standard deviation of Jason-Shannon distance in the whole dataset. The result from this figure aligns well with the area thickness comparison results. Specifically, the recurrent cell fusion impacts more on series B-scan than on specialist B-scan. Moreover, after applying recurrent cell fusion, the Jason-Shannon distance of two thickness distributions of all retinal layers from the pair scan converge to smaller values. To conclude, our recurrent cell fusion algorithm effectively reduces speckle contrast and improves SNR. Moreover, it improves the consistency of retinal OCT segmentation among different OCT devices. Therefore, it can be a valuable pre-processing step for retinal OCT imaging analysis. With that, I would like to thank you for your listening.